mula sa Asian Community Development Council. Ito ang Fil-Am in Focus. Mondays at 12 noon, right here on PHLV Radio.
Magandang hapon po sa inyong lahat and welcome to Fil-Am in Focus, a program by the Asian Community Development Council or ACDC, where we discuss critical issues, challenges, and opportunities affecting Filipino Americans. Ako po ang inyong host, Edelwiess Solano. On today's episode, we are talking about health insurance and open enrollment. And now is the time to obtain health insurance to make sure you're covered for 2023. At ACDC, we offer free assistance for those looking to get the right coverage, and today we have one of our very own clients joining us to talk about her experience getting help from one of our licensed health navigators. And luckily, our ACDC health navigators was able to find the right coverage for her so that she does not have any gaps in health insurance. And also joining us today is one of our navigators, Joy Avendaño, who is a licensed navigator and who speaks Tagalog. And so I'd like to welcome Joy and also Maria, or I would call Maria Ababia Hall, and I will call Tita Bobby to Fil-Am in Focus. So welcome po sa inyo, Tita Joy and Tita Bobby.
Thank you for having us.
Thank you po.
Okay. So Tita Joy, I'd like to start with you. So for many of our kababayans, finding the appropriate health insurance can feel like, maneuvering through a maze. And so it is the reason why there are brokers or agents and health navigators to help with the process. So ano nga po ba ang health navigator? Can you explain to us what a health navigator is?
Kami po ay tumutulong para makapag-enroll yung mga kababayan natin sa tinatawag na Affordable Care Act, also known as Obamacare. That's a state-based program. So with Nevada Health Link, tumutulong po kami na mag-enroll sa mga tao. Open enrollment is now here. It started November 1st and it will end January 15, 2023 for their coverage for the whole year of 2023. So first of all, ang pinakamalaking bagay dyan is dapat meron silang lawful residence para mag-qualify dyan. Pangalawa, dapat kailangan taga-Nevada talaga sila. And we ask for proof of Nevada residence. And then, yung hinihingi, yung mga social security, kung may trabaho, yung mga pay stub. Tapos, tutulungan namin sila mag-apply, sasubmit namin online through Nevada Health Link, and the system will assess the information that we input for the client, and then right there and then we can see kung approved sila o hindi. Yeah, and most of the time they're approved because we filter them out, like interview them for eligibility. So kung medyo may kulang, medyo hihold lang natin muna yung application nila, and we'll go back to them and help them enroll.
So the health navigators po at ACDC, like what you explained, provide unbiased or actually unbiased specialists that provide help consumers in providing coverage through the marketplace. Yung marketplace po na binabanggit nyo is Nevada Health Link, tama po ba?
Tama.
Okay, and then you said po you complete the eligibility and enrollment forms through to secure the coverage. And so how do you ensure po that the process is explained in plain terms to individuals who are not very well versed in the process?
Luckily, most of my clients, I would say 99% are Filipinos. Although we Filipinos who speak English, but there are some things you cannot explain exactly in English or translate into Tagalog. So I am free to talk to them. I ask their permission if I can talk to them in Tagalog. Some of them are born and raised here, so they don't understand. But you can kind of feel that with their accent if they were born here, right? So, are you okay if I speak Tagalog to you? Oh, yes, tita, yes. Yeah. And then, if they don't speak Tagalog, then it's easier to explain in English, right? Yeah.
So So you make sure po that the terminology and procedures are explained
understood.
In a convenient manner po.
Convenient. And as you know, health insurance is a maze for everybody, like going around the circle, and it's confusing for them. So I explained to them what the present healthcare system is in America. Because ano yung broker? Ano yung ganon? Ano yung ganon? Then I will start from ACA. What is ACA? The Affordable Care Act. That's the present healthcare system in the US. And then it became state-based. Some states don't participate. They go federal with healthcare.gov. But some states like Nevada, they went state-based. So we have the marketplace called Nevada Health Link. Yeah. So I make sure they understand, because it's useless going around the circle and nakaganon sila. Ano kaya ibig sabihin nun? And it's health insurance very confusing. You really have to use a language that they will understand, and you have to check with them if they understood what I was talking about.
Opo, and then you have to explain that in their native language too.
Right.
And I'd like to bring in our guest Tita Bobby po. So, paano niyo po na hanap yung si Tita Joy po as a health navigator?
Okay po, bago ako mag-umpisa, can I say, hi! Magandang umaga, Pilipinas, Luzon, Visayas, and Mindanao. This is Tita Bobby is here.
You're so cute.
Okay, by the way, nahanap ko yun, naano ko yun si Joy through my friend Pilipina din.
Opo.
Kasi alam niya kasi diyan siya pumunta kay Joy. So, yung tinawagan si Joy, sabi niya, itong dadalhin mo. So, dinala ko lahat ang sinasabi niya. Tapos, nandoon ako sa opisina niya, parang wala talaga akong pag-asa makakuha kasi that's all she know. Kasi ang income mo this year, o ang income ko, kasi nagtrabaho ako ng January to February, so it's a lot of money. So that's why I'm not qualified. So in the first place, I'm applying for Medicaid. It doesn't go through. So naghanap siya ng iba, hindi rin. So umuwi ako, parang na-heart ako kasi yung insurance ko sa union, malapit na mag-expire kasi wala na akong hours. So if I gonna take that one, I need to continue the union premium. I need to quit from my job. But I said, no, I'm not, because I'm gonna pay every month $114. But the dental is not covered. So that's why I keep praying to God that God help me, because I have a maintenance and I have nowhere to ask except this one right now from Nevada Link. So I think like 2 weeks or 3 weeks, tinawagan ko ni Joy. Hey, Bobby, punta ka dito ko. Bakit? May nakita daw siya na pwede daw ako. Kaya pagpunta ko dito, pagpunta ko sa office niya, ayan na-approve ako. Kasi thank you, Lord, because next week, my insurance is out.
Opo. So,
para bang blessing in disguise na...
May term yan sa Tagalog, hulog ng langit.
Oh, hulog ng langit, yeah. Hulog ng langit.
Yeah.
Sabi ko, thank you, Lord. Because, if you kapit ka lang sa Panginoon, tutulungan ka talaga.
So,
that's why bumalik ko kay Joy. At that time, matagal-tagal yun, no? Kasi marami pang mga kailangan nila. Pero at least nandoon na yung record ko, naka-apply na ako.
Right.
So, ni-review na lang lahat. Kasi sabi ni Joy, abandon daw ako. Siya, yes. He abandoned me since my daughter is 8 years old.
Opo.
Yeah.
Ano po ba, kung maikwento niyo po ba, ano po ba yung biggest concern niyo po in finding a health coverage? Ano po ba yung nangyari sa inyo na kinailangan niyo po humanap ng health insurance?
Okay, naghanap talaga ka kasi when the COVID end, they closed the buffet. Then they called me in 2020 back around August or parang August or October. So in order for me to go back there, I need to get all the requirements for COVID, right? So I passed. So from there, I worked from that time until this last February. Then until that, I don't have insurance, but I'm still covered because I still have an hour previously.
Opo.
So I keep wandering around asking everybody what I'm gonna do. because I don't have a job. Then my I don't have an hour. They don't call me anymore at work. So I tried to find a job. I don't know why. I have no luck. No one hire me. So, by the way, I said to myself, I need to find somebody to know where I'm gonna get this thing. So, at the church, I found my coworker that
Tess Berha.
She went to Joy. So I said, i-try mo lang doon. So tinatry ko. Pero, in the beginning, I was so worried because I have maintenance.
Opo.
I'm worried talaga kasi mag-run out yung insurance ko sa union at hindi pa ako makahanap. Ay, anong gagawin ko?
Opo.
Kaya, I have nowhere to go. That's why I went to her right away. So that's why in the first place, it's like, umuwi ako na, ano ba yun? Hindi pa ako nakapasok kasi
May problema.
Opo. Ano nga ba, Tita Joy, yung problema nung pagkatapos kayo?
When we were doing the application, when it came to the marital status, she said she's married, but she has a problem. She cannot file jointly with her husband because she's been abandoned for 20 years. So that yung subsidy will not be given to her if that's the case. And so the premium will be so high. I said, no, hindi niya kaya to. So I said, Bobby, I'll get back to you. I have to find out something. And then, yun nga, I consulted the policies of Nevada Health Link, and it was there very clear that if you've been abandoned for a while or a victim of domestic abuse, you can file a single. Even if you are not officially divorced, but you've been abandoned, you can file a single. Bingo, there it is. So I called her back. I said, I have good news for you, Bobby. Pwede na tayo. Come here. Come over here at finalize na natin yung application mo. And so, being single, she was given a subsidy, what they call the Advanced Premium Tax Credit, or APTC. That helps lower the premium. And at the time, I enrolled her last year, she was only paying $26, which is not bad, right?
Yeah, it's not
And
bad.
the most important thing there is she's covered. And it will take care of her maintenance, her doctor visits, knowing that she lost hours at work. So these are the people we would like to help, right?
Opo.
And I'd like to tell you that I never gave up on her kasi naawa ako sa kanya.
Oo.
Yeah.
Halos iiyak na ko sa harap niya. Oh my God, now I really need this. Kahit anong gawin ko, no one hiring me. So
Yeah.
I said to myself, please Joy, help me Joy, because this is the only way I can get my health insurance. Otherwise, I'm in trouble.
Right.
Kasi pag wala kang insurance, tapos may maintenance ka, mahirap talaga yun.
Yeah.
It's so hard.
Yeah, mahirap din magkasakit sa panahon na to. And
Right.
lalo
Kasi
na,
pag mamiss mo yung maintenance mo, hindi ka agad ka pero on the long run, pag wala kang insurance, wala ka ng maintenance, ay aatakihin ka talaga dyan.
lalo na kung may karamdaman ka at hindi mo nga magkagamot. Eh, lalong,
Right.
Kagaya yung tinawagan niya ako, I was like this, oh Lord, thank
Hulog
you
ng
so
langit.
much. Thank you so much.
That's one thing with the ACA. Hindi nila tinitingnan yung pre-existing conditions. Right? Sa Obamacare, hindi. Pasok ka dyan kahit may sakit ka.
Oo,
The
yun
more
yung
you need
kagandahan
it.
nung health insurance ng coverage ngayon ng ACA. So,
Kasi pag kinuha ko yung sa union, ano ba yun? I follow the union told me that quit for your job and you're gonna get $114 every month. Then when I went to Joy, it's only $26. So, no, I'm not gonna quit from my work. Then I'm gonna pay $114. I go to $26 every month. I said to myself, ano ba yun sa Tagalog? Pag magtiyaga, may
nilaga.
May nilaga. Yan.
That's right.
Opo. So, aside from yung may na-alleviate po yung fear nyo na nagkaroon po kayo ng health coverage, at the same time na hindi po kayo nangangamba ngayon, how important is it po to find someone who speaks the same language as you po?
As a Bisaya?
Opo, Bisaya at saka Tagalog po.
Both ways. It's not hard for me. Pero sometimes ang Tagalog ko magkahirap-hirap, magkalisod-lisod. So that's why I'm always speaking English because even my English is not that good. That's why some Filipino, ito naman si Maria pa English, Bisaya pala. O hindi mo sinabi akong Bisaya ka, di
Tapos si Tita Joy pala, Bisaya din.
Bisaya din.
Swak na swak.
I think kayo po, Tita Joy, how important is it na for someone or consumer to find a health navigator who speaks the same, who can speak the native language?
Let's admit, sometimes language is a barrier to people coming to have health insurance. Although, as I said earlier, Filipinos, we speak English, but some of them are not confident enough to express it in English, right? So when they find somebody who speaks your language, tontuwa sila. Because they can express whatever they would like freely. Yeah.
And it really avoids yung miscommunication.
Right, that's right.
And then, katulad po yung sinabi nyo, you can express, they can express themselves freely. And then, you actually understand yung cultural background, yung kung ano yung mga nuances. And then, you can actually communicate seamlessly with each other po.
Exactly.
And then yung katulad po nung sabi ni Tita Bobby, yung having that peace of mind nga po na nakatulong kayo na hindi na siya nangangamba ngayon, na thankfully natulungan niyo po siya sa ma-alleviate ba yung kanyang fear.
Right.
So ano po ba ang other importance of having health coverage?
First of all, when you sincerely help someone, word will spread. At maraming lalapit sa'yo. O punta ka doon kay ganun kasi matutulungan ka niya. Okay. So, importance ng health insurance, there's no denying. Life is full of surprises, you know. Sometimes bad things happen to good people. When you're not ready or prepared or you don't have any health insurance at all, mahirap. Although, of course, in North America, you will never be turned away from hospitals, right? But I don't know how often you can do that. So, importante ang health insurance. Especially when the ACA was introduced in 2010. Marami talagang natulungan. Especially that pre-existing conditions are never considered.
Yun yung talaga yung pinaka importante yung kung sino may mga pre-existing ngayon pwede silang makakuha ng health insurance. And
it wasn't like that before, especially if you go to a broker. Ang unang tatanungin, may fill up ka dyan na yung mga sakit mo ililista mo. At the end, hindi ka nila kukunin pag marami kang sakit.
And talaga po, tama kayo dyan, yung accidents and illnesses can happen at any time.
At any time.
Yeah, and without health insurance, talaga you'll be responsible for covering, high medical cost. And talagang it will put a severe financial risk to you and your family if you don't have any health insurance.
And also you hear some people, mahal naman ng Obamacare, mahal naman yan. Sabi ko, no. It depends on your income, size of family. Ang tinutulungan talaga ng Obamacare is yung low-income group. Kaya meron silang income threshold na tinatawag. If you go above 400% of that, mataas din yung yung premium mo monthly.
Paano po yung... sorry po, go ahead.
It goes that kung mataas ang income mo, lagpas ka na dun sa income threshold level limit nila, mataas ang magiging premium mo, pero i-compare mo sa mga broker, if they go straight to the broker, mura pa rin. Mura pa rin. Yeah. We have proven that.
Paano po yung mga prescription po? Does it make it affordable also?
There are plans that you have to consider. You ask the client how many prescriptions you have in a month, what are these prescriptions, and then you look for a plan that will make prescription affordable. Yeah.
So, mayroon po kayong sinasabi na open enrollment and special enrollment period. Ano po yung difference po nila para mas maintindihan po ng ating mga listeners and
since we
viewers?
started open enrollment already November 1 pa, before that was special enrollment period. Medyo strict yung mga requirements. That's why pag hindi sila pumasa ng special enrollment, we always tell them, we will come back to you during open enrollment. Because open enrollment, mas maluwag. Basta lawful residents ka, may social security, you're from Nevada, may trabaho ka o wala, you can prove your income, then pasok ka. Kaya mas madaling mag-enroll sa open enrollment. So, November 1 to January 15 is the period that, and as word spread, madali lang, tatawag na sila. Minsan, wala pang November 1. Enroll na daw siya. Sabi ko, hindi, I'll get your name, I'll interview you first. And then, for sure, I will call you back come November 1. Yeah.
Okay. And ano po, Tita Bobby, ano po yung process for you? What was the process like for you po when you went to get your health insurance, get help to get?
Oh, the process?
Opo. Was it?
It's not that hard.
Opo.
Just ask, she gonna Joy will tell me, bring this thing, that one, then we're gonna meet in her office and she will help me. And, you know, I owe her a lot because she helped me a lot. Because sometimes, you know, I cannot understand some of the English word. I will ask her all the time.
Opo.
Sometimes, wala nga siya sa office niya, nakabakasyon, tinawagan ko.
But
Yeah, that's what she is. She's just like helping me. She helped me a lot.
Opo. Ay, maraming salamat, Tita Joy, for, you know, for
Always here to help.
for helping not just Tita Bobby but a lot of our kababayans in making sure they are covered and, you know,
Yeah.
they have that peace of mind.
Yeah, kaya nang sabi ng mga kaibigan, paano mo yun nakuha? Remember Datuan, Violeta?
Si Bioli,
Oh,
yeah.
si Viole. Hindi mo na, sabi mo ang totoong pangalan ko, sino? Kasi hindi nila alam yung Ababia. Maria lang talaga ang nalaman nila sa
I
akin.
know. I met Bioli. Client mo dati yun. Tapos, nung sabi ko, kaibigan mo pala si Maria Ababia. Hindi niya alam na Ababia yung pangalan niya.
At kilala lang po kayo sa Bobby.
Hindi niya sinasabi
Maria.
yung tunay niyang pangalan,
Maria.
Bobby lang.
Yeah,
Maria.
hindi ko na lang nilagay yung Ababia kasi mataas na eh.
Aha.
So Maria na lang, Maria Hall. Then yung tinanong niya, "Hoy, ano yung pangalan mo?" Pagkakita namin ni Violeta. Kasi nakita kami ni Joy. Oh, ano? Hindi ko alam yung sinabi niyang Maria what?
Ababia.
Tapos magkakakilala po rin pala pa kayo.
So she knows. But she know me as a Maria. That's it.
Right.
Ay, si Tita Violi.
That's why I'm happy that even right now, she said, last week, you need to, pupunta ka dito sa office before we go to the radio station
I will
para
bring you.
ma-enroll. She gonna help me to enroll. Naka-enroll na. Tapos na pala eh.
Oo.
Naka-enroll na.
That's great.
So, that's it. You know what? Magtiyaga lang talaga.
Opo.
It was automatically renewed actually
Yes.
every year. But I
Yes.
have to discuss with clients whether to keep that if they're happy with the plan or
Because
hanap tayo ng mas mura.
Of
Oh, ito,
course.
mura
yeah.
na talaga to kasi wala na.
Yeah.
Opo.
I told her this morning, nothing is lower than zero. -0, malamig na yung freezing point.
But pero po yung mga deductibles and premium na ano naman po, maganda naman po yung...
Maganda yung plan niya.
That's good. That's,
Yeah, yung mga deductible ko, mura lang.
Yeah,
that's
injectables mo.
Mura lang kaysa noong sa sa Union, pag doon ako sa Walgreens, hindi free. Pero ngayon kahit dito sa mga pharmacy, mura lang.
affordable po. So basically, it
Because
fits
she's
your...
got a
ano po,
certain copay lang for mga RX niya.
So, yung ano po, titignan nyo po yung lahat na yung available po no plans dun sa Nevada Health Link in Marketplace po. That's how you were able to shop and see and
Yun,
review
at
the
the end of
plans.
the application naman, whatever we input in as information, it will present to you the cheapest plans based on her income.
Yes.
Yeah.
And
So,
then
doon na lang kami mamimili.
tapos and you choose po based on kung ano po yung kailangan nyo and fits your budget.
Yeah.
That's great. And ano po, before we close po this episode, abilis po no, nung oras, ano po yung advice nyo po sa ating mga kababayan, Tita Bobby?
Mga kababayan katulad ko naghanap ng health insurance, just keep looking and don't give up because somewhere down the road, you're gonna find it. Some of the people that I know, I will tell, just go to Joy. That's why I
Salamat.
tell them, just go to Joy and she will help you. Hindi man kaagad, pero believe me, it's happened to me. That's why
Yeah.
I was thankful to her.
Thank you din po.
Oh, thank you, Tita Bobby. Okay po, Tita Joy. Ano po yung advice nyo sa ating mga kababayan na o kaya yung ating mga kabataan, lalo na yung mga kabataan na, bata pa sila, tingin nila hindi nila
Iniisip
kailangan ng
na
health
magkakasakit
Oo.
sila.
O kaya yung mga walang health insurance din. Ano pong
Always
advice
get
mo?
covered. Lalo kung may ACA, why not? And I always tell them it's not expensive. It depends on your income. So, yeah. Huwag kayong makikinig dun sa iba na, mahal naman yung Obamacare. No. Come on, we'll try. And we'll see.
Anyayahin po natin sila na i-contact po kayo sa...
Yeah. Open enrollment November 1 to January 15. Ang telepono ko po is 702-738-0800. My name is Joy Avendaño. But we have other licensed health navigators that speak Vietnamese, Chinese, Cantonese, right? Cantonese, Mandarin, Korean, Thai, and Cambodian. So these people will be able to help you if you speak those languages. Yeah, just give us a call.
So at ACDC po, we have health licensed navigators that are bilingual.
Right, that's true.
So they speak Tagalog, Vietnamese, ano pa po yung mga lengguwahe?
Thai, Cambodian, Korean, Cantonese and Mandarin, and of course Tagalog and English.
Opo. Okay. So, again, open enrollment for 2023 runs from November 1 through January 15, 2023. And so, enroll by December 15 for coverage that starts January 1. So if you need help during open enrollment, please reach out to us at healthcare@acdcnv or give us a call at 702-489-8866. So thank you, Tita Bobby and Tita Joy, for joining us today. And thank you again for listening and watching Fil-Am in Focus, a program by the Asian Community Development Council. So for more information about ACDC, please visit our website at acdcnv.org and follow us on our social media channels. Ako po si Edelwiess Solano, ang inyong host. Abangan po ang aming susunod na episode. Hanggat sa muli.